I'm going to talk about mood stabilizers, which are treatments for bipolar disorder and depression. To make that diagnosis, refer to my other videos. There's, I think, 3 or 4 other videos that I have talking about recognizing and diagnosing bipolar disorder and the different types of bipolar disorder. But today, we'll start with the mood stabilizers. The first mood stabilizer, the one that was the gold standard that everything is based around as in terms of efficacy, how it works. So that was lithium. Lithium was a great one. It worked well. It stabilized the mood, decreases acute mania, manic episodes, cyclothymia, bipolar 2, blah, blah, blah. It worked great. Lithium is not a drug. Lithium is a naturally occurring alkali metal. It's on the periodic chart. It is an element. It is formulated for people to take as a salt. That's great. It stabilizes your mood, kicks in 10 days. It works amazingly. What are the problems with lithium? As a mood stabilizer, although it works, can be given once a day as lithium carbonate. I think the brand name is Lithium. Lithium has some issues. It can cause acne of your face and your back, a fine tremor like this. It's not good. Everyone thinks you're drinking. It can cause frequent urination, fluid retention, swelling of your legs, memory problems, cognitive slowing. Also, lithium's got some very dangerous side effects. One can shut down your thyroid, which is right somewhere here. Yeah, you could take a pill, you could take Synthroid, so that's solvable. But after being on lithium 15, 20 years, it shuts down your kidneys, causes an interstitial nephritis. You need your kidneys to live. There's no pill for that. You need a kidney transplant. I've had 2 patients who needed kidney transplants. Needless to say, this is not my favorite turn to drug when treating bipolar disorder. Also, it's got drug interactions. You can't use diuretics. You can't take Motrin. You have to be very careful with other compounds that affect the kidney. It dehydrates people. So when you dehydrate people, it can raise the level of the lithium to toxic levels. And lithium can get toxic very easily. It's got a therapeutic window between 0.8 and 1.2 or 3 milliequivalents per liter. So take too much, you get toxic. It's got a narrow range. Too much can really kill you. You start getting vomiting, diarrhea when the dose is too high, electrolyte imbalances, and you could get a cardiac arrhythmia, or some metabolic issue could really hurt you, maybe kill you. So lithium also got drug interactions with like Motrin, ibuprofen. Not my favorite, although it works great. And also, all the drugs I'm talking about today are teratogenic, the mood stabilizers. What I'm talking about are lithium, Depakote, Tegretol, there's Carbamazepine, Carbamazepine, Trileptal, and Lamictal, Lamotrigine. They're all teratogenic, meaning women who are pregnant don't take these drugs. There's other alternatives for you. Do not take these drugs if you're pregnant. Let's go on number 2, which, as time went on, Valproic acid, Depakote, it became popular. It works as well as lithium. I would say lithium works better, but I think Depakote's a little safer. It stabilizes your mood. It can be given once a day. It's called Valproic acid. It comes in, at first it came in immediate release forms. Now it's an extended release ER form, which can be given once a day. Like lithium, has a narrow therapeutic window. You take too much, you get toxic, get very, very ill. You need to maintain a level between 50 and 100 milliequivalents per liter. So like lithium has a therapeutic window, and you have to draw blood to make sure you're in that therapeutic window. It has side effects. Bothers your stomach. Dyspepsia, growling, irritation, diarrhea, constipation, weight gain. It can cause cognitive slowing. Depakote can cause a tremor. Here's a beauty. It can cause hair loss. needless to say, can make people tired. That's why, okay, I use it. All these drugs have their place, the right person and the right time. There's ones that I favor, but I wind up using them all. So Depakote, you can overdose, narrow therapeutic window. It has these GI side effects, tremor, weight gain, cognitive slowing, hair loss, can make people tired. Can be given once a day. Valproic acid needs blood monitoring like lithium. Okay. I think Depakote or Valproic acid has advantages over lithium, but it still has its problem. Another one is Carbamazepine, Tegretol, which stabilizes your mood, stops mania. Problem with that, can shut down your bone marrow, so you don't make any kind of red blood cells or white blood cells. It can particularly causes an aplastic anemia, or it can cause an agranulocytosis, which means you don't make white cells. You need white cells to fight infection, not good. And it can cause anemias, just generalized anemias. You have to monitor the level of this one too. It has a narrow therapeutic range, 10 to 20. It works. Side effects, if it can affect your gums, it can cause drowsiness, has GI side effects. It's not so bad in terms of its side effect profile. They came out with an altered form of carbamazepine called Trileptal, which is oxycarbamazepine, which didn't have the aplastic anemia. Didn't shut down your production of red and white blood cells, so it's much safer. It did not have a therapeutic range. Wasn't as dangerous, and it stabilized your mood. It just didn't seem to work as well as Depakote or lithium, but Trileptal is an option. I think that one can have effects on sodium, lower your sodium. Also with Tegretol, carbamazepine, get this, it causes a severe rash in people of Asian descent, so you can't give it to people who are Asian. Okay, the next one, Lamictal, Lamotrigine. This one has to be titrated very slowly. It can cause, in 0.08% of people, a lethal rash called Stevens-Johnson syndrome, which you can die from. Your skin peels off. Barring that, which is extremely rare, 0.08%, 99.92 don't get it. It takes 6 to 8 weeks to titrate on the full dose. It works well. Not a lot of drug interactions, no weight gain, no cognitive slowing. I would say this drug is my go-to drug right now. It works well. And remember, all these drugs are teratogenic. You cannot take them if you're pregnant. So Lamictal is the choice in the range of 1 to 200 milligrams a day. Those are the big ones. Lithium, valproic acid, carbamazepine, oxycarbamazepine, and Lamotrigine, Lamictal. Those are the 5 mood stabilizers. Of those, I favor Lamictal due to its minimal drug interactions, its safety profile. The rash, which could be fatal, is extremely rare. It's tolerated well, no weight gain, no drowsiness. It still has effects if you're pregnant, but just don't get pregnant when you're on it. It seems to work, but each drug has its place. Now you'll hear about other compounds. You'll hear about Topamax. Topamax may have benefit in treating bipolar disorder. It's up in the air. The problem with this drug, all these drugs, Depakote, carbamazepine, oxycarbamazepine, Lamictal, Topamax, they all treat seizures. And they all can have some effects in intermittent explosive disorder, rage, post-traumatic stress, autism with rage. But Topamax causes cognitive slowing and aphasias, word-finding problems. It makes the birth control pill not work as well, so you could get pregnant on it. It's teratogenic. It can also be used for neuropathic pain conditions. I've used it. It can be associated with weight loss, which is good, but it's unclear how well it works. You'll hear about other drugs that are anti-seizures like Neurontin, gabapentin, and an altered member of this family of gabapentin called pregabalin. They both affect GABA. They may have some benefit, but they're not indicated for bipolar. I don't think they work that well for it. Nowhere in comparison to the other ones I discussed. But Neurontin can be used for alcohol dependence to decrease craving. It can be used for neuropathic pain, seizures, fibromyalgia, gabalin, which is the altered version of a more potent form of Neurontin, which is gabapentin. It can be used for neuropathic pain. It can also be used for seizures. It may be associated with some addiction. These are mood stabilizers. I'm just trying to discuss all members of the class. They each may have some part in mood stabilization. Basically what these drugs are, I'm going to put up my arm here and just sort of describe a little bit of how they work. From here to here is a neuron. These are dendrites. This is the cell body. This is the axon. This is the axon terminal, and it's got a little sticky thing here for demonstration purposes only. There are 86 billion neurons in the system. The system works by axon terminals here. Imagine millions of these lined up. It's not one for one. There could be 1 million here, 100 million next to them, 200 million. So what happens is an axon terminal releases a neurotransmitter into what's called the intersynaptic cleft. Dopamine, norepinephrine, serotonin, glutamate, epinephrine. They're released from the axon terminal, which is this thing. It releases into the synaptic cleft. It stimulates these dendrites and causes the neurotransmitter to turn into an electrical signal that sends an electrical potential down the neuron to the axon terminal where it releases a neurotransmitter here. This isn't 1, 1, 1. This is the neurotransmitter stimulates one neuron and the message goes to an electrical signal to this axon terminal where it releases more neurotransmitters where then hundreds of thousands, if not millions of neurons will pick up that neurotransmitter signal. Electrical, chemical, electrical, chemical, electrical. That's how the brain sends signals. Now, why am I telling you this? Because lithium, how that works, it numbs the glutamate signaling. Remember, glutamate can be associated, it's very involved in depression, agitation, excitability. So modulating glutamate and decreasing the receptor sensitivity to glutamate, these receptors here, decreases neuronal activity. So it's a calming effect. The next one, Depakote, affects GABA. GABA receptors are on this axon terminal and are inhibitory and slow neural transmission down on this axon sheath, it's called, so that the electrical stimulation cannot go down the axon. What else? Remember benzodiazepines, Valium, Ativan, Klonopin, baclofen, affect this GABA pathway, which is inhibitory, which slows down neural transmission. That's why some people may use Klonopin, clonazepam, Ativan to treat bipolar. It's inhibitory and slows down this neuronal transmission. What else is going on here? Neurontin and Lyrica, gabapentin and pregabalin affect GABA and stimulate gamma to inhibit neural transmission. Carbamazepine, oxycarbamazepine, and Lamictal affect channels of ions, sodium mostly. And that affects the excitability by affecting how polarized or unpolarized this axon terminal is, meaning can the electrical signal go down it? And if you affect these sodium channels, which are little channels in this axon, it means it can't transmit an electrical charge as easily. It changes the polarization of this axon, so it doesn't transmit electrical energy as quickly. That's a little, you like the little hand thing? You have to get the thing. This is just one neuron when there are 86 billion. And it goes axon terminal, releases neurotransmitter, stimulates the dendrite, goes down the axon to the axon terminal where it releases neurotransmitters, and then a bunch of dendrites get stimulated and create electrical signals that go to millions upon millions of neurons. Those are mood stabilizers. But no conversation here would be complete without discussion of the atypical anti-psychotics. So we're mood stabilizing with the 5 big ones: Lamictal, Valproic acid, Carbamazepine, oxycarbamazepine, and Lamotrigine. Those are the 5 big ones. Lamotrigine is probably the one I go to first. Could topiramate, Topamax, Neurontin, or lyrica pregabalin, or benzodiazepines like clonazepam have some effect on bipolar? Yes. Now we go to the atypical antipsychotics. They are mood stabilizers. Briefly, let's go through them. Olanzapine, which is Zyprexa, it works. It mostly works by blocking dopamine in this mesolimbic pathway. Like this, maybe? It's a neural tract in your brain. Let's just briefly describe the disadvantages here. It does work well. Olanzapine, Zyprexa works well in stabilizing your mood. Puts on a lot of weight. I mean, like a real lot of weight, to the point where you get high triglycerides, high cholesterol, fatty infiltration, diabetes, really bad. Okay, that may have its place in people who need to gain weight or when nothing else works. It's there. The next one, Seroquel, quetiapine, it works well. It's an atypical antipsychotic. It does stabilize your mood and control mania and stop cycling, but it makes you sleepy and it puts on weight. All of these drugs may cause movement disorders because they affect the pathway, the nigrostriatal pathway in your brain, and alter dopamine receptors, causing mood abnormalities, tics, spasms, and permanent disfiguring, even incapacitating tardive dyskinesia, permanent tics. There's other ones, Geodon, Ziprasidone, which works well. It can help with depression. They affect dopamine and serotonin. Ziprasidone works well, but still has movement disorders, spasms, and they all affect dopamine in this other tract, the mesocortical tract, that goes right here to your frontal lobe and can make you numb, apathetic, amotivated. This part of the brain, the frontal lobe, makes us people. Our big frontal lobe separates us from chimps, and that makes us think and plan and initiate and motivate and create. Well, it blocks that part of the brain. Not so good. So we talked about olanzapine, quetiapine, ziprasidone. There are some that I don't like: Respiridol, Respiridone, and Palperidone. I think it's Respiridol and Invega. These drugs, they can control mood, but they put on a lot of weight. They're associated with a lot of tics, movement disorders. They can increase prolactin, causing breast enlargement in men, and lactation, or women start producing breast milk. They drug people, they make them drowsy, they have this blunted affect. So Respiridone and Palperidone, known as Respiridol, and Invega, I'm not using anymore. When they came out, there was nothing really else but them. You could use them, but we're not using them anymore. There's other ones, Abilify or Piprazole, and Brexpiprazole, which is Rexulti. They work great. They control your mood. They stabilize mood. They can actually treat depression. They're great add-on drugs. When you need an antidepressant that partially responds, you can add these on. Once again, the movement disorders, muscle spasms, weight gain, affect numbing of the frontal lobe syndrome it's called. So they work, but especially in older white women are really prone to these tic disorders. And these spasms can occur, severe spasms with these drugs. There's other ones, what's Saffrosacenapine, Marginal effect, this one I would put in the marginal class of never can make that drug work. The next one, Vraylar, cariprazine, another one marginal in its ability to work. Lurasidone, Latuda, I did a video on that. I like that drug the most, but it can still cause movement problems, muscle spasms, frontal lobe of numbing, where it blocks this mesocortical, where your brain is. It goes from the center of the brain here, all the neurons, the railroad tracks that go from here to here. The ones that go from here, they're called mesolimbic. That's where all the hallucinations, delusions occur from. There's a new one, Caplita, lumateperone, which is out, which appears to treat bipolar. The jury's out on this one. I'm having some success with it, but they all have movement disorders. And this class of drugs, because it does block dopamine, it can affect serotonin too. It can have some devastating effects on personality because it affects that frontal lobe. Another fact that I want to discuss is the glutamate. Lithium desensitizes people to glutamate. Glutamate is excitatory, so that's how lithium can decrease mania. It's through modulation of glutamate. Remember PCP, phenylcyclidine, angel dust? That potentiated glutamate. It made people agitated, crazy, hallucinating, violent. Remember angel dust raged? Well, there's another drug, Riluzole, which blocks release of glutamate, which has an antidepressant effect and a calming effect. So I'm just mentioning these as add-ons. I've done other talks on these, but you need to know that they can be helpful in the treatment of depression and mania. The big one is Spravato esketamine. Through modulation of NMDA receptor, which carries out the message of glutamate, it blocks that and improves mood. So that's the gist of mood stabilizers. Try to keep it simple. Hopefully that explains things. I hope everyone likes my hand analogy and my arm analogy. Thank you.